Bismillah ar-Rahman ar-Rahim. We shall have a short lecture or a short discussion, and I will start with these slides of some statements, and I want to get your reaction to them, and I'll pick you one by one. We'll start with the sisters. The first statement is, I cannot trust that doctor to operate on me. I saw him beating his son very cruelly and abusing his driver. What do you think about it? Does it make sense? Yes, you. Does it make sense, or is it something? If a doctor is cruel to his son, does that affect how he works as a doctor? Would you refuse to allow him to operate on you? Use your mind, please. Maybe no. Okay. And then the next one, I am not willing to follow that doctor's instructions. I saw him driving through a red light. The doctor says, stop smoking, it's dangerous. But you saw him driving through a red light. Will you respect his instructions? Yes, brother? Yeah, you? Yeah. Yes. Can you trust his prescriptions? If you know he drives through red lights? Okay. And then the last statement. You think the doctor's personal life has nothing to do with his profession? Can you be a good doctor and a bad person at the same time? No. Yeah. Yeah. So I think the first duty to yourself is your character. If you do not fix your character, you'll have a lot of problems as a doctor. And I think you need to improve. This doctor, he says, now who can answer this? Yes, you? This Abdul Basir. Yeah. Okay. Well, the sister is just sitting down. Yes. The first statement, what concerns me as a doctor is my technical efficiency. My character may be good or bad. It has nothing to do with my profession. Would you agree with that? Use the mic. Yes? Oh, did I pick someone? Okay, we go to the other side. Okay, at the end, yeah, you. Yes. Is that statement okay? Do you agree with it? You don't agree? Okay. Then the next statement is yes, front line, front row. The doctor is already an adult and his character is set. We just have to appreciate what is positive and put up with what is negative. You agree? Can we change him or we just give up? Maybe we can change him. A little bit of change can occur. What about social problems? Can the doctor come to work and leave his social problems at home? Yeah, let me see. Yes, that line, the person on the... No, you, yes, yeah. Can you leave your problems at home? You should, but can you? If you had a fight with your wife, can you be very nice and smiling to patients? Yes, but can you do it? You try. Yeah. So really the summary of this is that you've got a duty to take care of yourself. Because whatever is wrong with you will show in your professional work. The second thing has to do with professional development, that we need to continually become better. Now let us go to the last line on this end. Yes, last line, this end. The first statement. I have divided my life into two phases and will never allow the two of them to interfere with one another. I want to get education and training, then finish and make money. No more education. You agree with that? Use your mic. Yes, you brother. Last row. You don't agree, why? لماذا? He just doesn't agree. Okay. What about conferences? Is it good to attend conferences? What about this statement? Any sister wants to comment on it? Front row, middle. Attending medical conferences is a good excuse for tourism. The academic discussions that take place have no relationship to the real work of practicing medicine. You agree with this? Yes? You agree? Yeah. This actually, unfortunately, is true. Many people go to medical conferences, but they do not learn anything from them. So, a second duty for the physician is to make sure you have good professional development. You keep on getting better. Then another duty you have is to the people around you, because remember, as a doctor, you are a role model. People are looking up to you, what you do, and they learn from you, they emulate you. So this statement, our consultant told us to do what he said and not what he did. See, when examining a patient, always ask for permission. That's the ethic of doing things. Don't follow what I'm doing. I do not ask for permission. Is that a good teacher or a bad one? Is good or bad? He's bad, but he's honest. He tells you what you should do. Remember that لِمَا تَقُولُونَ مَا لَا تَفْعَلُونَ. Don't say what you're not doing. So you need to be aware that people are watching you. So your words and your actions should be the same. Also, we are in a medical team. It's our duty to make sure that it is a well-functioning team and not just a hierarchy with a dictator. Should interns fear medical students, and interns, should they fear the consultants? Or should they talk with them as friends? Hello, Ali. What do you think? I don't agree with you. Should it be collegial? Should it be have a sense of fear? Consultant comes, everybody cowers and gets afraid. You learn better when you're afraid? Yeah. That's another problem. That again, we need to learn to be in a team, as a team. It's a duty for every doctor to make sure that the healthcare team is a team. And what about stress? If you are stressed, should you go home or should you continue working? Go home. But if you have stresses every day, what happens? Financial problems all the time. Really, one of the things that we should watch out is being a doctor means organize your life well. So you have got few stresses, because those stresses will affect your life. And one of the biggest stresses today is debt. Borrowing and living beyond your means. It creates stresses that patients will see, because when you talk to them, they will see you are stressed, and maybe you will be cruel to them. So, let us look at the summary of this. I wrote this lecture actually. It's 15 pages. I put it here. And I'm going to finish very soon. I don't want to talk for long. Because I know you people, you don't want to listen for long. You don't want to discuss for long. You want it short and quick. But there is a trick. We can make this lecture very short, just mention the main points, but there is this long one here. You need to copy it and study it. Because in the examination, we are going to ask details. In fact, you may take it from me, none of the things I have said here will come in the examination. What we'll ask will be from the paper, so you need to read it. So I think the first duty is to yourself. Take care of your iman, your taqwa. Realize that being a doctor is amana to be fulfilled, and take care of your character, akhlaq. A doctor is not like anybody else. Your character matters. Now, the second thing you have to do is to keep on improving. None of us is good. We need to keep on improving every day, both professional in terms of our character. As the Prophet said in Sunan al-Darimi, Man istawa yawmahu fahuwa maghbun. If your 2 days are the same, it means you operate at the same level on 2 consecutive days, you are a loser. So a doctor has got a duty to keep on improving all the time. Improve your character, improve your professional abilities, improve your social abilities. And this means that before you go to bed every night, ask yourself, how was my day? What did I do bad? What did I do wrong? How could I do it better? So self-improvement is a duty that you owe to yourself. And then you owe a duty to the other colleagues in the team in terms of teaching them and learning from them, respect, group dynamics, and working smoothly together. But this etiquette doesn't include being quiet when immoral things are being done. When you know of something wrong being done in the clinic, in the hospital, you need to speak up. You cannot say, I have got a duty to be nice to my colleagues, the other doctors, and I will keep quiet. You need to speak up, because that will affect the whole profession. And as I said, you need to deal with the stress. Stress generally is defined as a gap. There is a problem and you cannot cope with it. That gap between the problem and your abilities is the cause of stress. We need to know what causes us stress. We need to know our reactions to stress. Some are psychological, some are physiological, and then we need to learn methods of coping with the stress. Medicine is a very stressful profession. Which specialty is most stressful in your view? ER? Yeah. Do you know which doctors commit suicide most? Dentists? Yeah, I had dentists. Yeah. I am surprised why dentists commit suicide most. I should expect neurosurgeons and emergency room physicians to be most stressed. But there's a lot of stress in medicine. And if we are not aware of this stress and deal with it, we'll make mistakes. Now, the Saudi Council for Health Specialties listed duties of a doctor to himself, and I think I don't have to go through them. There is a long list, and you can read it in the written paper. Some of them are very general, some of them are very specific. But these are things that you need to read and remember, because we'll ask you about them. Now, you have got duties to the medical profession. You need to do service. It means you need to work in the hospital. If you use your hand phone for 2 hours a day and take care of patients for 2 hours a day, you are not fulfilling your duty. You need to make sure that all the 8 hours you're on duty, you are actually providing service. Leadership is a duty that you have to give. As a doctor, you're a leader of the nurses, you're a leader of interns and medical students. And research. We need to stop being consumers of knowledge and become producers of knowledge. So those are three duties that you owe to the medical profession. And then there are other duties, again mentioned in the Saudi Medical Specialties Commission, that you owe to other people. Also very straightforward. I don't need to go over them. They are in the notes, and we'll be asking you questions on them. So you want to read them and be aware of duties to others. Okay? So I'll stop here. Any questions? Okay. Now let me summarize. Yes? Huh? Yes? Use the mic, please. I mentioned research. It's a different to the medical profession.
The doctors are always busy with patients, and so how the doctor manages research and without it is affecting its stress.
Yeah, that's a very difficult question to answer. I know one thing. Research is necessary for good medical practice for two reasons. One, when we do research, we can discover better ways of treating disease. That's one reason. The second reason, even if we do not discover something new, a doctor who does research is a doctor who thinks. A doctor who does research is someone who thinks, who reads, who is following up. So I would prefer to be treated by a doctor who does research than one who does not do research. So medical practice quality comes with doing research. So for these two reasons, we need to find time to do some research. The question is, where do we get the time? And that is something that the Minister of Health has got to solve. They need to give doctors some protected time to do research. Because if they do not do research, in the end they will not be good doctors. They will practice using very old knowledge, and they will be very dangerous doctors in the process. Okay? So, if no other question, let me summarize what I said, and I said very little. And this is deliberate. As I told you, what we'll ask you in the exam is none of the things I said. It is the things that you will read, and the notes are available here. I said that the doctor has got a duty to himself, basically his character, his professional development, and dealing with his personal problems to make sure that they do not come to the job and affect adversely. You've got a duty to your colleagues. You need to teach them, to work with them, interact with them very well. Basically, these are communication skills. But I said this duty does not include hiding mistakes. When there are mistakes in the practice of medicine and you are aware of those mistakes, you need to speak up. Because in the end, our duty is more to protect the patients than to protect our colleagues. We've got a duty to the medical profession. We need to do our service. We need to exercise our leadership role. And we need to do research to add to the body of medical knowledge. So thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.